Thank you.
DCA.
Well, thank you. Thank you to the committee for inviting me, Dr. Natarajan, Dr. Lalit Verma, Dr. Bhavna. I, I went from India to US in 1993 after actually practicing in Delhi for 3 years, and then spent some few years doing inherited retinal diseases and electrophysiology with Jerry Fishman at Chicago. Then did my residency again in US from University of Illinois, Chicago, and then did medical retina fellowship. Then I went to Jacksonville, Florida at University of Florida, where I've been there for now almost 15 years. So I've been indirectly involved with NEI and NIH all these years through Foundation Fighting Blindness, through Diabetic Retinopathy Clinical Network, which is mainly funded by NIH. And I just wanted to talk briefly about this network and how this, maybe we can conceive some idea of bringing that kind of a network in India, because I think with the population of diabetes patients here, we can get some answers much faster than we can get it in US. So this diabetic retinopathy, it used to be called Diabetic Retinopathy Network, and all the protocols were for diabetic retinopathy. But recently, just last year, there was a demand for just not keeping diabetes, but other retinal diseases. So the name was changed to DRCR Retina Network. This is actually available on, these slides are available on the public site of DRCR. Anyone can go to it and learn about it. So I'm not representing DRCR or University of Florida for this. So the DRCR Retina Network mission is to improve the lives of individuals with, used to be diabetic retinopathy, but now it's with retinal pathology, by performing high quality collaborative clinical research. So the most important part is the collaboration, and the other important part is the network quality of this organization, which is one of a kind. And so there is a collaborative network between the network itself, the organizing, the committee, the network chairs, and then the clinical sites, which there are 509 current investigators from more than 170 sites. And then there is a coordinating center which kind of coordinates all these protocols. And obviously nothing can be done without funding, and NEI is through, is the main funding organization for this, these projects. And of course, to some extent, the National Institute of Diabetes and Digestive and Kidney Diseases also funds these projects, but it's mainly by the NIH. And this is, there's collaboration with industry as well in the last few years with all these anti-VEGF, injections that are available now. And so the industry has been very kind to actually supply all these medications for holding these trials. So this is just a brief look at the network. There are about 158 active sites as of last year, and there are 493 investigators that are active, although total there have been more than 1,000 investigators, and it's mainly in US and Canada. And anyone, any retina specialist in the US and Canada can apply, and that is reviewed by, and if they meet the criteria of being an investigator, then they can be included in this. And anyone actually can submit a protocol idea, and I've submitted quite a few, and so I know the process that it's pretty easy to submit the idea, although obviously not all ideas are accepted because it has to go through a stringent process. So the review process, once you submit, and anyone submits an idea to DRCR-Net, there's an initial review to see whether the topic is of public health importance and can it be done. And then the operations committee reviews, meets twice a year and reviews all these protocol ideas. And actually the submitter joins the meeting via phone and explains the rationale for why they want to have this particular protocol accepted by the DRCR. and the designated ideas then are presented to the investigators. We have two meetings, one winter meeting, one summer meeting, and this is presented to all the investigators and kind of a vote as to whether, if this was a protocol, how many investigators would be likely to join. So based on the operations committee and based upon how the investigators feel about it, the ideas are reviewed by the operations committee again. They finally make a recommendation to the executive committee, and then they make the final decision as to whether it will be accepted as a protocol to be run in the DRCR network. So the network started in 2003. I've been part of it since 2006. And as you can see, there are so many protocols that have happened since 2003. And these are the current protocols that are being enrolled. And I'm not going through each of the topics. I just wanted to give you an overview of how the DRCR runs. And then any publications that comes out of it can be found on the public website. And the top 5 enrolling institutions, the main authors come from that for any paper or manuscript that comes out from any of these protocols. And then it's not only the primary endpoint that is kind of published, but there can be so many other publications that can come out from these protocols. And just to give you an idea, we had a winter meeting last month, and these are some of the protocols that are in development that were accepted. So thank you for your attention. I just wanted to bring it to your notice that this is something that I actually talked to the DRCR people to see if they would be ready to collaborate with India to kind of, because they already are doing it, it may be easier for them to collaborate here, but they were not ready at the moment for the collaboration. But, you know, it can always be started. That's not an issue. So thank you very much for your attention.
So Dr. Garor, yes.